Good morning. NJBIZ and Horizon Blue Cross Blue Shield of New Jersey would like to welcome you to the 15th Annual Healthcare Heroes Awards ceremony. We are thrilled to have you joining us for this morning's virtual event. During our program, we will honor individuals and organizations that are making a significant impact on the quality of healthcare in New Jersey. We are ready to begin and hope you enjoy the program from the comfort of your homes and offices. And now, please give a warm virtual welcome as we introduce your host, Ken Cazales, publisher of NJBIZ.
Good morning. I'm Ken Cazales, publisher of NJBIZ, and I welcome you to the 15th Annual NJBIZ Healthcare Heroes Awards program presented by Horizon Blue Cross Blue Shield of New Jersey. What an honor for NJBIZ to be hosting these awards for 15 years. I am so absolutely humbled to stand before you this morning. As some of you may know, this event means a lot to me, not just because I am fortunate enough to lead an organization that gets to recognize and honor so many healthcare heroes, but also because this event hits home pretty hard. Not only am I a cancer survivor who was treated in New Jersey, but also because I, along with a little help from my wife, okay, maybe it was a little help from me, raised our own healthcare hero, as our daughter Danielle has been an ER nurse for the last 4 years. I know firsthand how important all of you are, and I am so lucky to play a role in recognizing these truly amazing group of people and organizations. The last year and a half has not been an easy road to travel for any of us, but especially not for you. Thanking you for what you do is always appropriate, but during these times, even more so. You are all true heroes, and I am so thrilled to honor so many of you this morning. At this year's event, we are also recognizing the Lifetime Achievement honoree, Dr. Robert L. Johnson, currently the Dean of Rutgers New Jersey Medical School and Interim Dean of the Robert Wood Johnson Medical School, for a lifetime of amazing accomplishments. We will be hearing from him a bit later in the presentation, so stay tuned. Since the COVID-19 pandemic began to impact our communities in 2020, New Jersey healthcare workers have never wavered in their commitment to their patients, colleagues, and organizations. Not only did they continue doing their jobs, but they took on additional responsibilities and worked longer hours, they created and shared new and better ways of doing things, and they contributed to the continued growth of their organizations and the community, all while keeping their spirits high. They truly epitomized the word hero for going above and beyond the call of duty to make the Garden State a healthier and safer place to live and work, despite being faced with the overwhelming challenges of a pandemic. While, after seeing glimpses of the forest, it appears we may have taken a few steps back into the trees, I am confident that life as we once knew it cannot be that far away. And we at NJBIZ want to make it clear to everyone working on the front lines in our communities, you are so appreciated and the work you're doing continues to matter more than ever. Nothing would make me happier than to meet all of our honorees face to face and congratulate each and every one on a job well done. As we continue to navigate these unprecedented times, each day brings us closer to coming together in person for our award events as we did in 2019. Until then, we are happy and so proud to provide you with this special virtual program, which allows us and all of you the ability to still celebrate together this morning. With that being said, I truly hope all of you, as well as those you love and care about, are all healthy and safe. We will get there together. I do encourage everyone joining us this morning to engage with one another by using the chat in the right-hand portion of your screen. This is where you can post comments and cheer on your colleagues, family, and friends. If you don't see the chat, you may need to click on those 3 dots in the upper right-hand corner to request the desktop version. I also ask all of you to please stay tuned through to the end, as it's important that we share in the successes of everyone being recognized this morning. And there are also a lot of personal videos submitted by the honorees for all of us to enjoy. Before we jump into the awards, NJBIZ is extremely fortunate to have several sponsors helping to make this event a reality. I'd like to begin by introducing the presenting sponsor of the 2021 Healthcare Hero Awards, Horizon Blue Cross Blue Shield of New Jersey, an extremely special partner with us on this event. Horizon Blue Cross Blue Shield of New Jersey, the state's oldest and largest health insurer, is a tax-paying, not-for-profit health service corporation providing a wide array of medical, dental, vision, and prescription insurance products and services. Horizon Blue Cross Blue Shield of New Jersey is leading the transformation of healthcare in New Jersey by working with doctors and hospitals to deliver innovative, patient-centered programs that reward the quality, not quantity, of care patients receive. Learn more at www.horizonblue.com. Horizon Blue Cross Blue Shield of New Jersey is an independent licensee of Blue Cross and Blue Shield Association, serving nearly 3.7 million members.
I'm Kayla, and this is what I work for. To teach him, to protect her, and to take care of me, too. I need health insurance that does the same, that makes it easier to see a doctor, so I don't have to worry. This is my life, and this is how Horizon Blue Cross Blue Shield of New Jersey works for me, and him, and her.
Joining us this morning from Horizon Blue Cross Blue Shield of New Jersey is Alan Karp, Executive Vice President, Healthcare and Transformation Management.
It's my privilege to be with you again this year to represent Horizon and celebrate New Jersey's healthcare heroes. Thank you to NJBIZ for giving us the opportunities to support this program. I hope we can be together in person soon. To say our state has been through a lot is a huge understatement, but our healthcare heroes have been with the people of New Jersey every step of the way. Despite facing unprecedented challenges, you never let the COVID-19 public health emergency stop you from caring for those in need. There are no words that can truly express our appreciation and gratitude for those who work in healthcare and the sacrifices they make for their patients. I applaud your work and dedication. This event is a great opportunity to recognize individuals and organizations for their significant impacts on healthcare in New Jersey. This is something that's very important to us. As you know, Horizon has been committed to improving the quality of care in New Jersey for nearly 90 years. We are proud to be a partner with many of you to make healthcare more accessible in our communities. Like you, we are here for the people of New Jersey now and always. As healthcare heroes, you're here for New Jersey day in and day out. On behalf of Horizon and its members and employees, we thank you for the great work that you do every day. You are truly our healthcare heroes.
I'm Miles, and this is what I work for. To be my best for them and for me, in body and in mind. I need a health insurer that helps me get the care I need for both. That has mental health professionals that I can talk to when I need to, because when I feel strong and secure, so do they. This is my life, and this is how Horizon Blue Cross Blue Shield of New Jersey works for me.
Thank you, Alan, and Horizon Blue Cross Blue Shield of New Jersey for being such an important part of this event for so many years. I would now like to recognize our major sponsors, beginning with Hackensack Meridian Health. Hackensack Meridian Health is a leading not-for-profit healthcare organization that is the largest, most comprehensive, and truly integrated healthcare network in New Jersey, offering a complete range of medical services, innovative research, and life-enhancing care. The network's notable distinctions include having more top-ranked hospitals than anyone in New Jersey, as recognized by U.S. News & World Report. Hackensack University Medical Center is the only hospital in New Jersey with the #1 adult and children's hospital rankings.
We believe healthcare can keep getting better. That we can make it simpler, kinder, and even more miraculous. So we'll keep pushing ourselves to make our best even better. Because that means you will keep getting better too. Hackensack Meridian Health. Keep getting better.
Thank you to Hackensack Meridian Health. Our next major sponsor is New Jersey Innovation Institute. NJII aims to revolutionize healthcare through data-driven transformation. The healthcare division of NJII is focused on designing and supporting interoperability throughout the state, connecting health systems and providers to their patients using technology, analytics, and metrics. NJII's goal is to streamline population health and care coordination, resulting in improved patient experience while reducing the cost of healthcare. NJII works with healthcare delivery organizations to help them participate in and benefit from government-sponsored programs, as well as managing the NJHIN on behalf of the state. At its core, NJII is an advisory services company that enables innovation, transformation, and quality improvement through a variety of consulting and technology solutions, some of which are offered through NJII's for-profit arm, Healthcare Innovation Solutions.
At the New Jersey Innovation Institute, our goal is to turn ideas into workable solutions which drive innovation. As the state-designated entity appointed to develop and manage the New Jersey Health Information Network, also known as NJHIN, we are responsible for working with healthcare providers, health information exchanges, and regional health hubs to connect to the HIN. By doing so, we aim to improve patient experience and population health while reducing the cost of care through innovation, technology, and metrics. Healthcare is truly at our core, and our robust healthcare division at NJII is proud to work alongside all of the healthcare heroes in New Jersey each and every day.
Thank you, New Jersey Innovation Institute. At this time, I would like to recognize Capital Health for being our live chat sponsor. Capital Health is the Central New Jersey, Lower Bucks County region's leader in providing progressive, quality patient care with significant investments in physicians, nurses, and staff, as well as advanced technology. Comprised of 2 hospitals, Capital Health Regional Medical Center in Trenton and Capital Health Medical Center Hopewell, and various outpatient care facilities and offices across the region, Capital Health is accredited by DNVGL Healthcare and a 4-time Magnet-designated health system. Capital Health serves as a Level 2 trauma center, as a regional perinatal center, including a Level 3 NICU, an award-winning cancer center, and a designated comprehensive stroke center. To learn more, visit capitalhealth.org. Thank you so much to Capital Health. I would now like to recognize our supporting sponsors, beginning with Bergen Newbridge Medical Center. Based in Paramus, Bergen Newbridge Medical Center, a clinical affiliate of Rutgers with 1,070 beds, is a full-service hospital with a 24/7 emergency department, surgical suites, physical rehabilitation, pharmacy, laboratory, radiologic services, and more than 26 medical specialties available through its ambulatory care center. As a safety net facility, Bergen Newbridge provides high-quality, comprehensive services to the greater Bergen County community, including acute and ambulatory care, mental health and substance use disorder treatment, and long-term care. The medical center, including its long-term care division, is fully accredited by the Joint Commission and is in network with all major New Jersey commercial insurance plans. The medical center is a veterans community care provider, proudly serving the healthcare needs of veterans, and is a leader in LGBTQ healthcare equality in the Human Rights Campaign Healthcare Equality Index for 2020. Thank you, Bergen Newbridge Medical Center. Our next supporting sponsor is RWJ Barnabas Health. RWJ Barnabas Health is the largest, most comprehensive academic healthcare system in New Jersey. The system includes 11 acute care hospitals, 3 acute care children's hospitals, and a leading pediatric rehabilitation hospital with a network of outpatient centers, ambulatory care centers, the state's largest behavioral health network, and affiliated medical groups. RWJBH and Rutgers University have partnered to create New Jersey's largest academic healthcare system. The collaboration aligns RWJBH with Rutgers education, research, and clinical activities, including those at the Rutgers Cancer Institute of New Jersey, the state's only NCI-designated comprehensive cancer center, and Rutgers University Behavioral Health. For more information, visit rwjbh.org. Thank you so much to RWJ Barnabas Health. Our final supporting sponsor is St. Peter's Healthcare System. Sponsored by the Roman Catholic Diocese of Metuchen, St. Peter's Healthcare System is comprised of St. Peter's University Hospital, St. Peter's Foundation, St. Peter's Physician Associates, and the St. Peter's Health and Management Service Corporation, overseeing the CARES Surgery Center and Family Health Center. St. Peter's is a regional specialist in maternity, pediatrics, diabetes, oncology, and geriatrics, serving the community for more than 114 years. St. Peter's sponsors residency programs in obstetrics, gynecology, pediatrics, and internal medicine, and is a major clinical affiliate with Rutgers Biomedical and Health Sciences. St. Peter's received its 6th consecutive Magnet designation for nursing excellence in 2020. Thank you to St. Peter's Healthcare System. Thank you to all of our sponsors. We so greatly appreciate all of your support. Another group that contributed to the success of this program is our independent panel of judges, not affiliated with NJBIZ, which includes Michelle Acito, Executive Vice President, Chief Nursing Officer, Holy Name Medical Center; Jackie J. Barris, Director of LGBT Programs, Perioperative Quality, and Clinical Anesthesia Techs at Robert Wood Johnson University Hospital, RWJ Barnabas Health; Dr. William Bernstein, Director of Medical Education, St. Peter's University Hospital; Dr. John Bonamo, Executive Vice President and Chief Medical Quality Officer at RWJ Barnabas Health; Dr. Stephen Brunkwell, President of Englewood Health Physician Network, Englewood Health; Samantha S. Hernandez, Regional Director for the Northeastern Simulation Center, St. Barnabas Medical Center, RWJ Barnabas Health; Mary E. Koch, Director, Nursing Education at Newark Beth Israel Medical Center, RWJ Barnabas Health; Kristen Ospina, Director of Nursing, Critical Care with Atlantic Health System, Morristown Medical Center; Christian D. Ragland, Manager of Diversity, Equity, and Inclusion at AtlantiCare; Dr. Patrick Smith, Senior Vice President of Sotera; Mark D. Sparta, President and Chief Hospital Executive, EVP, Population Health HMH Network, Hackensack Meridian Health, Hackensack University Medical Center; and Dr. Alyssa Siegel, Clinical Director of New Jersey Transition to Adult Coordinated Care at CHOP Specialty Care Center, Princeton at Plainsboro. This year, like every year, our judges had an extremely difficult task before them. Our 2021 nomination pool was full of extremely qualified professionals and organizations. After receiving the judges' final scores, we narrowed down the list to today's honorees, New Jersey's heroes, our heroes, and I couldn't be more proud of what we do at NJBIZ than I am right now. Now let's get on with the program and meet New Jersey's dedicated and amazing healthcare heroes.
At St. Barnabas Medical Center, the pandemic reinforced the importance of community and collaboration both within and outside of the medical center. The outpouring of support and resources from the communities we serve was truly heartfelt, and everyone's contribution made a difference.
Working through the pandemic has taught me to even more cherish the relationships that we have. As a wife and mother of 3 boys, this was an important lesson at home. The pandemic has definitely taught us all to treasure these relationships and to stand strong together.
The thing that I learned the most is what a deep well we have when we need to dig down and find those resources to do what's needed. I was particularly impressed by the nurses who were there in difficult and sometimes tragic circumstances, that they could just be there for every need for the patient.
Only together, with our strong dedication to God's healing mission and a commitment to service, can we continue to do the work that we have been called to do.
This past year has reinforced something I learned early on. As healthcare workers, we inherently have the ability to use our knowledge and creativity to ensure the safe and compassionate delivery of patient care remains our top priority, even in extraordinary circumstances.
During the COVID-19 pandemic, I learned how important it is to take time for yourself. Mental health is so important. When you use that time to clear your mind, you are able to open yourself up and really make a difference in your community.
A COVID-19 vaccination can certainly protect you, but it is our community partnerships, our relationships with friends, our neighbors, our colleagues that sustain us during the toughest times.
During the pandemic, I learned the value of teamwork like never before as our nurses, administrators, and physicians came together to battle this pandemic. None of us would have made it through a single day without the selfless dedication of our nurses and everyone at Capitol Health who ran to the front lines of our COVID unit.
The pandemic taught us the true power of partnerships, whether it be community, government, staff, or organized labor partnerships, and the essential need to work together to reach underserved communities, ensuring equitable access to quality health care for all.
At Atlantic Health System, it is not about what we learned, it's about what was reinforced. It took 18,000 team members, focused on their education, upping their game, and committed to caring for each other and keeping our community safe.
What we learned is how strong our employee commitment is for caring for our residents. Even during the uncertain times, our employees showed up to work despite the fear of the unknown. Our employees truly love our residents who've entrusted the Avalon and Bridgeway for their care.
The most important lesson that we learned from the pandemic was to expect the unexpected. And at Broadway House, our great clinical and professional team was focused on the medical care of all of our residents. And as a CEO of an organization, I was also focused on the care of our staff members.
From March to June of 2020, cornea transplant surgeries were halted. Despite this, Eversight kept hope in sight for more than 6,500 cornea transplant recipients and gave hope to thousands more through research that developed eye-banking protocols to ensure patient safety during the pandemic. This experience reaffirmed our commitment to donor families, recipients, surgeons, and researchers who need us right here in New Jersey.
We learned that we had incredible resilience and that we are completely dedicated to the well-being of those we serve, older adults. The team came together around this goal and exhibited these traits in a way that made me incredibly proud.
We learned the value of human interaction. People need to talk to other people. Even if the question is unanswerable and everything is most uncertain, there's a lot of comfort in hearing another voice on the line. And for that, help really is just a phone call away.
What we've learned throughout this pandemic is the importance of partnering with mission-driven, love-oriented, passionate individuals that want to make the community better. With an upsurge of violence in the community since the pandemic hit, team members such as Tracy Evans, Dr. Pruden, and Melissa have helped so much in partnering with the community to make sure that we launch this hospital-based violence intervention program. Since we launched, we've developed amazing relationships and we've been able to engage about 87 gunshot victims.
For me, one of the most positive things that came out of this horrific event was how our team came together, how our clinical staff aligned with our operational staff, with our facilities teams, with environmental services. But equally important is how the community supported us. How they came together really kept us going through this horrific event.
If there's one thing that the pandemic has taught us is that innovation doesn't have to only happen within the four walls of our business building, but can happen anywhere and at any level. And during the pandemic, we saw innovation accelerate and has charted our pathway forward.
The pandemic gave us an opportunity to step out of our box and to shift the way we do business. And the first thing we did was convert to virtual connections for our clients. We found that our employees were as productive working from home as they were coming from the office. The other thing that we implemented was self-care for our staff.
At St. Peter's Healthcare System, we recognize the unique physical, emotional, and spiritual needs of all of our employees. We're driven by a passion to make a difference in their lives by maintaining a safe workplace and engaging our employees in programs that help enhance their overall well-being. The commitment of our staff to caring for our patients and their families and to one another, especially during the pandemic, is unwavering. Their resiliency serves as an inspiration to us all. On behalf of everyone at St. Peter's, we're proud to be recognized as an NJBIZ Workplace Wellness Hero.
New Jersey's Sharing Network provides hope and compassion to our communities, even during the greatest of challenges. Our entire team remained brave and resilient. They never stopped working to save and enhance lives. 2020 was a record-breaking year for organ and tissue donation as more people gave the gift of life, to honor, to remember, and to give hope.
On behalf of the Regency Jewish Heritage family, I want to take this opportunity to thank the amazing healthcare heroes that came to work and cared for our residents during those dark times. You are what makes the Regency family so special and successful, and for that, we salute you, our healthcare heroes.
In January of 2020, I assumed the role as chair of the New Jersey Hospital Association Board of Trustees, and I made a prediction then that healthcare in New Jersey will see one or two major challenges that we didn't know about in January of 2020. Who knew that it could be the pandemic of a century? Some called me a clairvoyant, and others blamed me for the whole pandemic. But I want to thank everyone in New Jersey healthcare and those of you that supported healthcare, particularly our frontline workers, for all that you've done and are doing to pull this state through the pandemic.
Our first group of honorees is our Education Heroes. These individuals and organizations are being recognized for spreading the word about health education and by making a difference in their community and in healthcare. Here are the individuals being honored. Recognized as a pioneer in state-of-the-art treatments for complex infectious diseases, Dr. Ronald Nahas currently serves as the hospital epidemiologist at Robert Wood Johnson University Hospital, Somerset. As one of the founders of infectious disease care, he has helped grow the practice to a clinical network of over 40 nationally recognized infectious disease specialists across 9 practices throughout New Jersey. Most recently, he helped form RWJ's COVID-19 medical team and worked tirelessly to educate hospital employees, physicians, and community members about preventing the spread of COVID-19 and the importance of vaccination. Having received several outstanding honors throughout his career, he serves as a great mentor to students and younger physicians. He also spends time volunteering with the Infectious Diseases Society of America. Congratulations, Dr. Ronald Nahas. An educator at Holy Name Medical Center since 2007, Dr. Lori Podlinski first served on the faculty of its School of Nursing and then managed the operations, curriculum, and strategic planning for its Russell Berry Institute for Simulation Learning. As Director of Simulation Education for ISL, she was instrumental in it becoming New Jersey's first hospital-based center to earn accreditation from the Society for Simulation in Healthcare. More recently, Podlinski created virtual curricula within 1 week of the pandemic for the School of Nursing and the ISL, so education was able to continue without pause. She also redesigned a virtual hybrid orientation process for nurses and patient care techs, enabling Holy Name to hire 450 frontline caregivers who were critical to saving lives. Congratulations, Dr. Lori Podlinski. A clinically trained social worker and therapist, Sheila Robinson Kiss is a social entrepreneur focused on providing exceptional mental health education. She is the founder of Rebalancing America and Beyond, a national mental health and wellness organization dedicated to educating others about self-health and resiliency models. As a mental health educator and program development consultant with over 20 years of experience, she has launched live and online platform training programs that have reached over 600,000 individuals. An award-winning orator and the author of 5 books associated with mental health, she says the most meaningful part of her job is witnessing the impact that mental health education can have in the lives of men, women, children, and families who might otherwise suffer needlessly. Congratulations, Sheila Robinson Kiss. A clinician educator dedicated to service and teaching others to understand and serve vulnerable populations, Dr. Carmela Rocchetti developed and serves as the Human Dimension Course Director at the Hackensack Meridian School of Medicine, a unique program in which students learn about health inequities, working closely with individuals from underserved areas. In response to COVID-19 and the needs expressed by 12 New Jersey communities, Rocchetti created the COVID-19 Support Our Schools Task Force, which is managed by students and faculty to help districts navigate COVID-19 related questions and issues. Under her leadership, the Human Dimension program is changing the way healthcare is delivered, teaching young physicians to understand how to partner with communities to improve health in response to real-time needs. Congratulations, Dr. Carmela Rocchetti. During the uncertainty of the COVID-19 pandemic, Dr. Eva Skuka, an Associate Provost and Dean at Berkeley College School of Health Studies, embodied an example of selfless service and compassionate care, organizing the college's donation of medical supplies to area hospitals and volunteering at mobile COVID-19 testing sites. Berkeley College faculty, students, and alumni followed her lead, serving on the front lines as healthcare professionals in New Jersey and New York hospitals, vaccination locations, nursing centers, and physicians' offices, at times risking their own health to address the needs of their communities. She also played a pivotal role in securing a waiver from the New Jersey Secretary of Higher Education, allowing Berkeley College to conduct required laboratory sessions for graduating students. Congratulations, Dr. Eva Skuka. And now, introducing the organizations being honored in our Education Hero category. Since its founding, Atlantic Health System has been committed to building healthier communities through a variety of efforts, including providing essential information and educational resources. And never has that been more important than during the COVID-19 pandemic. By digging through information from federal and state health officials and sharing guidance from Atlantic Health leaders and infectious disease experts, Atlantic Health System helped bridge the information gap between the sources of clinical information and the public. Through easy-to-digest educational resources, parents, caretakers, local officials, teachers, business owners, and others were able to make crucial decisions while playing a role in their own health and wellness during the most disruptive and deadly pandemic of the last century. Congratulations, Atlantic Health System. Community outreach and education plays an essential role in NJ Sharing Network's life-saving mission, with its team members and hundreds of certified volunteers regularly participating in community events and activities and sharing organ and tissue donation-inspiring stories on social media and local news media outlets. NJ Sharing Network also worked closely with state lawmakers to pass legislation that mandates organ donation education in school curriculums. In response to low organ donor registrations in urban areas with the most residents waiting for transplants, NJ Sharing Network helps educate the public and engage new audiences through online youth forums, faith-based panel discussions, and campaigns such as Donation Needs Diversity, which played a critical role in generating a 14% increase in New Jersey registrations in 2020. Congratulations, NJ Sharing Network. Next up is our Innovation Hero category, which recognizes individuals and organizations for innovations in healthcare ranging from medical science discoveries to new program or treatment developments that are saving lives or improving quality of life. Here are the individuals being honored. As chair of the Department of Genetic Genomic Medicine at St. Peter's University Hospital, Dr. Deborah Lynn De Salvatore leads a multidisciplinary team of medical experts that provides comprehensive genetic services, compassionate care, education, and cutting-edge therapeutics that deliver hope to parents when they have nowhere else to turn. The most meaningful part of my job is not only being able to provide an answer to patients and their families who may have been on a diagnostic odyssey for years, but now more than ever, viable treatments and the potential for cures are right here in New Jersey, she says. Recognized for her groundbreaking research, De Salvatore has been published numerous times. Congratulations, Dr. Deborah Lynn De Salvatore. As Assistant Manager of Remote Patient Monitoring at Atlantic Visiting Nurse, Jennifer Dwyer took the lead role within the agency during the COVID-19 pandemic to initiate the Advanced Care at Home program, which enabled patients with COVID to go home safely. Using technology, she was able to positively affect safe patient care in the community and reduce patient anxiety while recovering from COVID at home. Dwyer and her team coordinated the care of these patients by reaching out to them daily, monitoring their vital signs, providing patient education, and coordinating virtual visits with a physician. The patients had the reassurance that they were monitored daily and could reach Dwyer if they had questions. Congratulations, Jennifer Dwyer. Feeling the weight of the pandemic, Dr. Neil Jain, an interventional radiology resident physician, had participated in a few national task forces before founding the COVID-19 New Jersey Medical Student Coalition, an initiative in conjunction with the Medical Society of New Jersey and put forth by medical and dental students across the state. Since then, Jane recruited over 100 members from medical and dental schools in New Jersey and led the group in delivering more than 21,000 pieces of PPE, manufacturing 10,000 face shields, co-authoring a Kids Quarantine Challenge book, collaborating with high schools to tutor students for the 2020 through 2021 school year, and delivering hundreds of groceries to high-risk families. His innovative work has been recognized both locally and nationally. Congratulations, Dr. Neil Jain. With a career as a pharmacist spanning 35 years, Leonard Lucani currently serves as the pharmacy manager of outpatient services at Holy Name Medical Center, where he almost single-handedly created the COVID-19 Infusion Center. From providing design, securing space, and developing policies and procedures, to arranging for staffing, arranging quality assurance, and regulatory compliance, and most importantly, shepherding so many of the patients through the service, his efforts have enabled the treatment of more than 1,200 patients with the monoclonal antibodies. The result has been a 70% reduction in hospitalizations among this vulnerable group of elderly and otherwise sick patients who had an underlying risk of death of 1 to 2%. Congratulations, Leonard Lucani. Founded in 2019 to be an academic center that could rapidly discover, innovate, and translate its findings to create real-world benefits for patients, Hackensack Meridian Center for Discovery and Innovation was put to the test less than a year later with the COVID-19 pandemic. But thanks to the leadership of Dr. David Perlin, CDI's Chief Scientific Officer and Senior Vice President, scientists and staff rose to the occasion, developing novel diagnostics, improving antiviral therapy, and supporting numerous clinical trial regimens. Under Perlin's guidance, scientists are also studying the biology of the virus, host factors that impact disease progression, and discovery and development of novel drug candidates. Driving progress forward is the most meaningful part of what we do at the CDI, he says. Congratulations, Dr. David Perlin. And now, introducing the organizations being honored in our Innovation Hero category. St. Barnabas Medical Center, a flagship hospital of RWJ Barnabas Health Medical Group, was hit hard during the peak of the pandemic. Recognizing that COVID-19 patients had continuing health needs post-acute infection, it launched the Adult and Pediatric Post-COVID-19 Care Program, which provides healthcare services to individuals who are experiencing residual symptoms of COVID-19 at least 4 weeks after the initial diagnosis. The goal is to deliver evidence-based care to patients across the region and utilize the research and the data that are collected to better inform the medical community around the diagnoses, treatment, and care of COVID-19 patients with PASC. Congratulations to the Adult and Pediatric Post-COVID-19 Care Program. With a mission to restore sight and prevent blindness through the healing power of donation, transplantation, and research, Eversight has made 6,500 sight-restoring corneal transplants every year in New Jersey and around the world. In 2020, it received the Eye Bank Association of America's research grant to study the presence of the virus that causes COVID-19 in donated cornea tissue. Results from the study showed a small but noteworthy prevalence of the virus in ocular tissues from individuals who died from COVID-19. This work affirmed the importance of the disinfection protocol that Eversight was already doing to ensure safety to corneal transplant recipients. Congratulations, Eversight. Created to serve New Jersey in its fight against the pandemic, the New Jersey Medical Student Coalition uses innovative methods to research demands in the community and design solutions to meet the unmet need. So far, it has overseen the manufacturing and distribution of PPE, grocery distribution, plexiglass creation, and blood drive creation. It also created the Blood Donation and Convalescent Plasma Initiative, which collected 78 units of blood from 82 donors over 2 single-day blood drives, helping over 195 patients. Its Dental Care and Education Initiative was able to work with engineers to design plexiglass barriers for dental offices and clinics. The team also co-authored a Kids Quarantine Challenge book. Congratulations, New Jersey Medical Student Coalition. Across the globe, more than 460 million people suffer from hearing loss, but only 17% of those who could benefit from a hearing aid actually use one. Many who go untreated are doing so because they're not interested in traditional hearing aid designs. Understanding that this barrier can deter individuals from obtaining the hearing health assistance they need, hearing aid innovator Signia launched Signia Active X, an entirely new category of hearing aids that enhance human performance by providing best-in-class hearing support in a discrete earbud form factor that looks nothing like the traditional hearing aid. It even features a face mask mode, which enables hearing aid wearers to better understand the speech of those wearing face masks. Congratulations, Signia! Paramedics at St. Joseph's Health are some of the busiest in the country, answering an average of 20,000 requests per year. During the first wave of the COVID-19 pandemic in spring 2020, the St. Joseph's Health Mobile Intensive Care Unit not only experienced a significant increase in total call volume, but also a 15% increase in respiratory calls. With EMS responders around the country struggling to safely provide aerosolizing treatments to patients with respiratory issues without exposing themselves to COVID-19, St. Joseph's paramedics created a combination of anesthesia masks, HEPA filters, and connectors to continue providing these life-saving treatments while maintaining safety. Once the COVID vaccine was available, the Mobile Intensive Care Unit began delivering the vaccine to the homebound. Congratulations, St. Joseph's Health Mobile Intensive Care Unit. Our next category, Public Health Hero, honors individuals and organizations that have made or are making an extraordinary impact on the public health of their community. Here are our individual honorees. In addition to her role as Director of Ambulatory Nursing at AtlanticCare, Sherry Bragg took on an additional role this year as the Clinical Facility Manager responsible for opening and sustaining the Atlantic County COVID-19 megasite, a collaboration among the state of New Jersey, the New Jersey National Guard, the Atlantic County Department of Health, and AtlanticCare. From the morning team huddle to the end-of-day leadership debrief, she handled the planned and unexpected moments and events 7 days a week with poise, patience, and professionalism, always working to ensure shots got into arms. As of June 11th, Bragg led her team in providing more than 271,000 doses, both on-site and at off-site clinics. Congratulations, Sherry Bragg! As New Jersey prepared for distribution of the COVID-19 vaccines in December, Atlantic Health System was well positioned to effectively make sure those shots found their way to as many arms as possible in an orderly fashion, largely due to the efforts of its Executive Director of Pharmacy Services, Dr. Timothy Leese. As distribution moved outside of hospital settings, Leese was integral to creating the protocols for transfer, storage, and distribution of the vaccines in community vaccination centers staffed by Atlantic Health. It was an absolute honor to play such an important role in helping our communities finally get on the path to normalcy, says Leese, whose leadership helped Atlantic Health administer more than 550,000 doses of vaccine to date. Congratulations, Dr. Timothy Leese. Serving as Chief Executive Officer of the New Jersey State Nurses Association, Judith Schmidt works tirelessly behind the scenes to advocate for nurses and for better healthcare, leading the association in securing several legislative victories that have created a safer public health landscape. Last year, she also issued a statewide call to action asking all available nurses to join the front lines against COVID-19. In all, 1,610 nurses raised their hands for deployment before the New Jersey Department of Health had its volunteer website up and running. Despite an existing nursing shortage, she also found more nurses by collaborating with the state government and elected officials to ensure temporary licenses for graduating nurses and master's degree prepared mental health professionals. Congratulations, Judith Schmidt. At an early age, Dr. Priya Shah quickly realized that she enjoyed working with children. From teaching children math and English at an orphanage in Africa to working with the pediatric special needs population at Rutgers School of Dental Medicine, her desire to serve children has never ceased. Today, as the Dental Care and Education Chair at New Jersey Medical Student Coalition, her focus is on making dental hygiene as fun and educational as possible for kids. This past year, she even discovered a unique way to keep young kids engaged and entertained during this pandemic through the Kids Quarantine Challenge book, which she co-authored and published. Passionate about education, she also created and spearheaded the Dental Care and Education Initiative. Congratulations, Dr. Priya Shah. In 2012, coinciding with the launch of the Affordable Care Act, Rosalind Young Daniels launched the flagship health and wellness program, Black Health Matters, to improve the health literacy of African Americans. Serving as president, she has led the program's website in achieving significant audience adoption, registering millions of monthly unique visitors. Focusing on traditionally underserved populations, Young Daniels has created education programs to improve breastfeeding, to encourage African American women to incorporate exercise into their lives, to train faith-based leaders in helping parishioners manage chronic disease, among others. Through the website this past year, she has also provided critical information to the African American community on COVID treatment via newsletters, webinars, and virtual conferences. Congratulations, Rosalind Young Daniels. And now, introducing the organizations being honored in our Public Health Hero category. Through the COVID-19 pandemic, Bergen Newbridge Medical Center saw that healthcare disparities were painfully prevalent, especially among its communities of color, its LGBTQ neighbors, and its Asian and Latinx residents. When vaccines became available, the medical center's equity team was quick to partner with key influencers in the community to form the COVID-19 Vaccine Equity Team to ensure equitable access to the vaccine for those underserved in Bergen County. Appointments were made available to members of communities most heavily impacted by COVID-19, and assistance to register for those appointments was provided. Education and community vaccination clinics were also added to mitigate the impact of social and economic conditions that are often barriers to positive health outcomes. Congratulations, Bergen Newbridge Medical Center. Recognized as one of New Jersey's foremost public health services, the NJ Poison Control Center at Rutgers New Jersey Medical School has protected the health and safety of state residents for decades. As New Jersey's primary defense against injury and death from unintentional poisoning, the Poison Center remains a vital resource for the public, healthcare professionals, and state, local health and safety officials. Since January of 2020, the Poison Center has played an essential role in the state's COVID-19 response by operating a COVID-19 hotline in tandem with its Poison Hotline. With the COVID-19 hotline sometimes receiving nearly 1,000 calls a day, staff and volunteers work tirelessly to ensure this vital resource remains available, assisting more than 107,000 callers to date. Congratulations to the NJ Poison Control Center at Rutgers New Jersey Medical School. With gun violence in Paterson becoming an ongoing battle, the Paterson Healing Collective was launched in 2020 to provide support and intervention for these victims with a goal of reducing retaliatory violence and further victimization once the victim recovers. In response to an increase in shooting victims over the past several months, the organization has already expanded its program. In addition to connecting with victims while they are hospitalized, a team responds to community-based violence incidents, connecting those engaged in violence to various resources. Each week, teams perform community intervention walks in troubled neighborhoods to bring information to the residents while identifying new potential mentees. Since its launch, 60 individuals have been successfully served. Congratulations to the Paterson Healing Collective. Thanks to its community partnership, Robert Wood Johnson University Hospital Somerset has made a significant impact in the area of public health over the years. In 2010, the hospital convened the Healthier Somerset Coalition of more than 100 organizations from Somerset County that have worked throughout the past decade to make Somerset County a healthier place to live and work, implementing workplace wellness initiatives, establishing safe streets for biking and walking, and forming a subcommittee to address mental health in schools. Most recently, in response to a surge of COVID-19 cases in the Latino community, the hospital launched bilingual outreach efforts as well as a Latino Advisory Council to help Latino residents, which resulted in a noticeable decline in COVID cases. Congratulations to the Robert Wood Johnson University Hospital, Somerset. Serving individuals living and working in Newark and the surrounding area, Rutgers Community Health Center at Rutgers School of Nursing offers everything from women's health, adult primary and pediatric care, to chronic disease management. Faced with the challenges of the pandemic, the center's healthcare professionals and staff never slowed down. They understood the need for the community already laden with health disparities and inequities to have an available haven to meet their needs during a time of uncertainty. They transitioned to using telehealth and admitted new patients who had no other place to receive care. Dedicated to being a healthcare provider where community means everything, the center continues to partner with community liaisons and seek opportunities to expand its services. Congratulations, Rutgers Community Health Center at Rutgers School of Nursing.
We are about halfway through the program, and I'm sure you will agree that this is a stellar list of individuals and organizations, and the rest will be equally as impressive. All I can say is thank you to these organizations that make such a difference in so many lives, and to all the individuals for making the career choices they have made. Now let's get back to honoring the rest of the 2021 NJBIZ Healthcare Heroes.
The reason I decided to pursue a career in healthcare is because it gave me the opportunity to save lives, to have the opportunity to do that every day, and to potentially save several lives a day was just such a privilege.
Nursing was not a decision. Nursing is my calling. I knew when I was about 5 or 6 years old that I wanted to be a nurse. I come from a family of educators, and my mom would always say to me, "Don't you want to be a teacher?" And I said, "No, I want to be a nurse."
During my high school years, my mother was diagnosed with breast cancer. And this personal experience has motivated me to become a doctor to cure all patients with cancer.
I decided to become a part of the auxiliary because I knew a lot of the women that belonged, and they would tell me what they did, and I thought that was great to help other people. I am also active in my community where I've lived my whole life in Belleville. I was there when they put the first shovel in the ground where we call Danny Goat Hill, where Clara Moss Medical Center now stands.
My very first healthcare hero was Dr. A. Leonard Luby, the pediatric hematologist that saved my sister's life and inspired me to become a physician. My second hero was my husband, Dr. Francis Paul Salvatore Sr. He established the first obstetrical unit at Bergstrom Air Force Base. He was a skilled, superb obstetrician, gynecologist, but most importantly, he was a master at the art of medicine.
Well, my grandmother told me that when I was 3 years old, I was toddling around saying that I was going to be a doctor. But the real decision came when I was a teenager, and I decided that I can serve my community by using my brain. And so that's what I decided to do.
When I first got out of school, looking for my first job, my mother was a head nurse in a psychiatric unit, and wanted to get into finance, and she suggested that I apply for this new thing called an HMO, and that was my first job out of college, was working for a startup HMO in the state of New Jersey.
I've decided to pursue my career in healthcare because I want to help reduce the stigma on mental health. Mental health is just as important as physical health. I am currently going for my master's in rehabilitation counseling to help make my dream a reality.
I don't think I can remember a time when I didn't want to be a physician. I spent 25 years as a surgeon, a surgical oncologist, and that evolved over time into a role as a healthcare executive.
I was always interested in the sciences, math, chemistry, and I was lucky enough to land a job in retail hospital pharmacies before I started pharmacy school. I actually still remember delivering medication as a pharmacy technician to a patient, and having that conversation gives you a sense of purpose.
I chose a career in healthcare because it was an opportunity for me to combine an interest in science with an opportunity to help others. As part of that career, I've actually done a lot of clinical research, which has helped create new knowledge as well.
My interest in healthcare began when my mother had kidney surgery. Although I was young at that time and didn't really understand what was happening, I saw the care that the nursing staff provided my mother. I made a connection at this time between the compassionate care that my mother received and her ability to recover and return home. So I wanted a career where I could provide that same service.
My father had lung cancer. So from the day he was diagnosed to the day he died, it was only 6 weeks. And I was in awe of the nurses and how they took care of him. So a little while after, I went to nursing school.
As a child, I was always interested in medicine and health. This led me on my path to becoming a nurse. As time went on, I realized that I enjoyed the advocacy role and became very interested in healthcare policy development and advocating for nursing to be at the table.
I decided to become a medical doctor and a healthcare educator because I believe these two professions represent the best and the highest of one's life's pursuit. Medical doctors and healthcare professionals get to witness humanity at its best and its worst. And as such, they get the opportunity to serve and give abundantly.
I decided to have a career in healthcare communications because of my grandparents. I loved them so dearly, and they left this earth way too soon. So I wanted to develop a program and platform that would empower African American families so that they could live their longest, best lives possible, because Black health matters.
I joined a local first aid squad, and that's how I got my start in emergency medicine. And then I went on to obtain my RN after the sudden passing of my mother. That's really what inspired me to continue a career in healthcare.
Our next category, Long-Term Care Facility of the Year, honors facilities that provide exemplary, innovative care for their residents and patients. Here are our honorees. Bridgeway Senior Healthcare, a family-owned and operated long-term care provider, has been committed to caring for seniors since 1981 with a vision of providing compassionate, quality care for seniors in a safe atmosphere that feels like home. With accomplished, dedicated staff, beautiful accommodations, and top-notch amenities, the senior-focused campuses in Bridgewater and Hillsborough have evolved to provide a continuum of care, including specialized long-term care, memory care, short-term, post-acute rehabilitation, and assisted living. Through the Bridgeway Care and Rehabilitation Centers and the Avalon Assisted Living Residencies, BSH continues to meet the changing healthcare needs of seniors and their families, and recently began bringing therapy services to the homes, rather than requiring transport to outpatient clinics. Congratulations, Bridgeway Senior Healthcare. Since 1995, Broadway House for Continuing Care in Newark has provided comprehensive medical care, behavioral care, and service coordination for seriously ill and disabled persons living with HIV/AIDS. Broadway House is New Jersey's only specialized long-term subacute care facility for this segment of the population and is a safety net for low-income individuals who lack insurance, may be eligible for Medicaid, Medicare, or cannot afford privately insured subacute settings. While best known for its HIV/AIDS programs, Broadway House also offers excellent subacute care for people recovering from accidents and other illnesses. The key to its success has always been an emphasis on holistic healing, medically, therapeutically, psychologically, educationally, and spiritually. Congratulations to Broadway House for Continuing Care. Recognized as a leader in long-term care, Juniper Communities has also been a leader in the fight against COVID-19 in long-term care communities. Starting April 2020, they were one of the first providers to implement full testing of staff and residents as a proactive, protective measure. Juniper invested heavily in purchasing tests and collecting data to track the spread of the disease in its communities. Other precautions included screening and temperature monitoring, enhanced infection control, social distancing, and staffing cohorts. To combat social isolation, Juniper created Virtual Connections, a hub for free activities, entertainment, spiritual and wellness-minded resources. It also promoted window visits for residents, drive-by parades, and a hug tent, which gathered global media attention. Congratulations, Juniper Communities! Regency Heritage Post-Acute and Rehab Center, a more than 30-year-old family group of rehab centers, has the distinction of being New Jersey's only system-wide CMS-rated 5 stars overall group. When COVID-19 was just beginning in New Jersey, Regency Heritage established one of New Jersey's first COVID units, bringing 75 beds online within 2 days of the state's directive to admit and help take the burden off of the area hospitals. As a result, Regency Heritage cared for nearly 1,000 COVID-19 patients with care and compassion in its dedicated unit. In addition to providing PPE for all staff, Regency created a Zen room featuring chase lounges, aromatherapy, sand raking, chimes, and more to help staff de-stress. Congratulations, Regency Heritage Post-Acute and Rehab Center. Up next, our Workplace Wellness category recognizes businesses that have implemented a company-wide wellness program, healthy work environment, ergonomics program, or other health-related activities benefiting employees. And the honorees are: as a leading academic health system, Cooper University Healthcare treated some of the most critically ill patients throughout the pandemic. Healthcare workers faced increased stress, anxiety, and traumatic grief caring for large numbers of COVID-19 patients and witnessing high loss of life. In response, Cooper proactively developed a resiliency resources team to provide direct support to its more than 8,500 team members throughout the pandemic and beyond, which includes support, education, and skill building through resiliency workshops, peer support groups, and digital content. In the past 15 months, the team's work has had far-reaching benefits, with thousands of Cooper employees engaging with the team or accessing the online resources on an ongoing basis. Congratulations to Cooper University Healthcare. RWJ Barnabas Health Institute for Prevention and Recovery has had a long history of contributing to the emotional wellness of the most vulnerable populations in New Jersey. During the COVID-19 pandemic, it applied the same approach to taking care of its own team members through a comprehensive employee self-care program, which not only resulted in a tremendous improvement in morale, but also a bigger pool of job candidates. Additionally, through its Hope and Healing program, the Institute provides emotional support services for healthcare workers affected by the COVID-19 pandemic, ranging from therapy dogs that lift the spirit of staff at the vaccine sites and hospitals to virtual support for employees in recovery. Congratulations, RWJ Barnabas Health Institute for Prevention and Recovery. Formed in 2007, St. Peter's Healthcare System is dedicated to offering an expansive scope of health and wellness services to the community. Equally integral to its mission is the safety and health of its employees through initiatives that encourage wellness habits, increase awareness of factors and resources contributing to well-being, inspire and empower individuals to take responsibility for their own health, and support a sense of community. St. Peter's Wellness Committee, spearheaded by employee wellness champions, launched the Go for Wellness initiative that includes a third-party wellness app. The program, which has enrolled almost 87% of the hospital's employees, is unique due to the choices available for employees, while also incorporating an understanding of the needs, stressors, and concerns of healthcare workers. Congratulations, St. Peter's Healthcare System. Our next category is Nurse of the Year, which recognizes individuals for their contributions to the nursing profession and the field of healthcare, as well as the positive difference that they have made in the lives of their colleagues, patients, and the community. These are our honorees. A commitment to high standards has long defined the career of Lois Beatty, Director of Quality and Regulatory Affairs at Broadway House for Continuing Care. Her mission, to maintain the stringent measures that keep patients safe, which earned her the nickname, the Queen of Quality, over the course of her 22-year tenure at Broadway House. That moniker took on new importance during the COVID-19 pandemic, as Beatty was relentless in her quest to keep patients and staff safe. playing a key role in the organization's low COVID-19 infection rate. According to Beatty, her proudest achievements in healthcare occurred when she graduated from Rutgers College of Nursing in 1976. It was at this time that my lifelong dream of becoming a nurse was fulfilled, she says. Congratulations, Lois Beatty. Megan Chan is a high-performing registered nurse who strives to meet the needs of the community and her coworkers by introducing innovations and swiftly adapting to change. Serving 3 departments within St. Peter's healthcare system, she continuously sets a great example for others with the high expectations she sets for herself. By providing exceptional care and going above and beyond pursuing all available resources for those she serves. During the COVID surges, she effortlessly pivoted to serve as a staff nurse on the COVID unit, while also conducting follow-up calls for the COVID recovery program. The most meaningful part of my job is being an advocate for vulnerable populations, she says. I believe that everyone should have access to quality health care. Congratulations, Megan Chan. Anyone who has had the opportunity to work with Mercy Mollery, a registered nurse at Hackensack Meridian Health JFK University Medical Center, will agree that her passion for her job is inspiring. From her proactive action with patient issues to her dedication in leading her team through the pandemic with innovation and safety in mind, to her passion for encouraging the professional and personal growth of others, she truly represents Hackensack's 5 C's: creative, collaborative, courageous, compassionate, and connected. The most meaningful part of my job is making a difference in someone's life every day, making a patient smile, showing empathy in their most vulnerable state, or helping a team member grow and reach their goals, she says. Congratulations, Mercy Mollery. Serving as Vice President of Patient Care Services and Chief Nursing Officer at Trinitas Regional Medical Center, Mary McTeague is responsible for the acute care and ambulatory care divisions, as well as case management, social work, performance improvement, infection control, and the Trinitas School of Nursing. As a key administrative leader, she was out front in the medical center's response to COVID-19, leading her team in dealing with every aspect of the pandemic, from staff issues, infection control, patient care matters, and more. Most recently, she co-leads the medical center's vaccination effort that to date has delivered the vaccine to more than 25,000 individuals. Throughout this troubled time, McTeague kept an even demeanor and inspired the care team to new heights of service. Congratulations, Mary McTeague. As the Director of Critical Care Services at Atlantic Health System's Chilton Medical Center, Laura Riley is a dynamic nurse leader who is laser-focused on quality and following the standards of care for clinical situations. Fearless in the pursuit of excellence, she developed the NJ Stroke Coordinators Consortium and took on the role as the first ever stroke coordinator at Chilton, addressing all the components for a successful stroke program and navigating complex systems of care across the continuum of care for this complicated patient population. Her ability to work collaboratively with others was especially evident during the pandemic as she worked tirelessly with the staff, patients, physicians, a multitude of support staff, and administrators to create COVID ICUs. Congratulations, Laura Riley. Next up, The Physician of the Year category recognizes physicians who consistently achieve high standards in the practice of medicine and are looked upon as a role model by their peers. Here are this year's honorees. As the director of the Institute for Clinical Research at Holy Name Medical Center, Dr. Thomas M. Birch was critical in structuring the hospital's clinical response to COVID-19. Faced with a hospital scenario that he nor his colleagues have ever encountered, Birch read the most up-to-date information, talked with frontline physicians and nurses every day, and chose medications to treat patients. He was also responsible for conducting the various studies that led to Holy Name being the first in the U.S. to use monoclonal antibodies to treat COVID-19 on an experimental basis, which turned out to be the only highly effective therapy. Under Birch's leadership, Holy Name opened a COVID-19 infusion center and dropped its hospitalizations by 70%. Congratulations, Dr. Thomas M. Birch. Serving as Surgical Director of Cardiac Transplant at Newark Beth Israel Medical Center since 2005, Dr. Margarita Camacho recently completed a groundbreaking milestone, the 650th heart transplant of her career, making her one of the elite top 1% of surgeons in this country who have performed this many transplants in a field where fewer than 5% of cardiothoracic surgeons are women. An organ is the most remarkable gift you can give to someone, and it is extremely gratifying being part of that process, she says. In addition to touching the lives of hundreds of patients, Camacho has also exposed countless students to careers in medical science by sharing real-life experiences about heart transplants and mechanical assist devices for heart failure. Congratulations, Dr. Margarita Camacho. Serving as the Medical Director of Hematology at Atlantic Health System, Dr. Mohammed Cherry has revitalized the leukemia program at Morristown Medical Center and earned the respect and admiration of fellow physicians, nurses, and patients. Cherry's expertise led to the approval of a new hematology oncology fellowship, which he leads. He has also spearheaded the CAR T-cell therapy program at Atlantic Health System, enrolling patients in clinical trials of his revolutionary new immunotherapy. As a physician, my passion has always been to take care of leukemia patients, helping them during their most difficult times, says Cherry, who on weekends can often be found on the hospital floors checking in on his hospitalized patients. Congratulations, Dr. Mohammed Cherry. As a clinical faculty member and board-certified family medicine physician within Atlantic Health System's Atlantic Medical Group, Dr. Christina Johnson specializes in preventative medicine, community medicine, and primary care research. During the pandemic, Johnson made it her mission to support communities of color by addressing concerns about COVID and vaccine hesitancy through speaking engagements and public service announcements. She is passionate about addressing disparities of care and is focused on improving diabetes care and sickle cell disease. Johnson also envisioned and developed the first Atlantic Medical Group mentoring program, open to any college or medical student who wishes to become a physician with a focus on students from underrepresented minority or socioeconomically disadvantaged backgrounds. Congratulations, Dr. Christina Johnson. Having trained as an internal medicine resident in Philadelphia during the height of the HIV epidemic, Dr. Mark Whitman went into infectious diseases to treat the many unknown mysteries of HIV. It is now so fulfilling to tell a patient diagnosed with HIV that they will have every opportunity to live a long life, says Whitman. With more than 25 years' experience in diagnosing and treating patients with life-threatening infectious diseases, Whitman currently serves as Infectious Disease Section Chief at Capitol Health, working in careful coordination with referring physicians to identify, treat, and prevent the recurrence of serious infections that require specialized care. Most recently, he served at the center of Capitol Health's COVID-19 response. Congratulations, Dr. Mark Whitman. Next is our Volunteer of the Year category, which honors individuals who contribute time or expertise to patients or healthcare issues and whose volunteer efforts have made a significant positive impact on the community. Here are our honorees. During the pandemic, Clara Moss Medical Center suspended in-person volunteer and auxiliary meetings for safety. Yet, Auxiliary President Angela Cuzzozaro remained motivated, and her actions helped maintain many time-honored traditions and fundraising activities at the medical center that provides support for innovative programs, state-of-the-art equipment, and needed capital projects. According to Cuzzozaro, one of her most rewarding moments was being able to provide home-baked cookies for employees of the medical center during the pandemic. This was my way of supporting healthcare heroes at the medical center at a time when I could not be with them in person, she says. Congratulations, Angela Cuzzozaro. As the volunteer in charge at the John Theurer Cancer Center at Hackensack University Medical Center, Gary Fromm has contributed more than 21,000 volunteer hours over 18 years of service, most recently acting as a courier during the COVID-19 pandemic. A career police officer and lifetime member volunteer firefighter, Fromm is by nature a first responder. Serving as the patient and family advocate, he is physically and emotionally available for patients, assisting with their concerns, helping smooth the healthcare process, and easing as many burdens as possible. Successfully assisting patients and their families in navigating their healthcare needs brings me great satisfaction and honors my parents' memory, said Fromm, who lost both his parents to cancer. Congratulations, Gary Fromm. Volunteering as chairwoman of the Young Professionals of the Bergen-Newbridge Medical Center Foundation, Krista Klee has led efforts to engage the community to support the mission of the foundation. For example, she brokered a partnership with the Phi Sigma Sigma sorority that provided the medical center's long-term residents with 400 Valentine's Day cards. Additionally, she worked with the sorority to raise thousands of dollars to purchase holiday gifts for the medical center's residents who have been drastically impacted by COVID-19. Throughout my time volunteering with the young professionals, the part that gives me the most satisfaction has been creating volunteer projects to help those in our community feel connected to others, she says. Congratulations, Krista Klee. And last, but certainly not least, our Healthcare Professional of the Year category honors individuals in healthcare whose job performance is considered exemplary by both patients and peers. Here are this year's honorees. As Paramus-based Bergen-Newbridge Medical Center found itself in the epicenter of the pandemic in 2020, it quickly and effectively rose to protect the vulnerable populations thanks to the efforts of its Chief Nursing Officer, Thomas Amatrano. With a nursing career spanning more than 40 years, Amatrano calmly rolled up his sleeves and walked into the unknown, performing COVID-19 nasal swabs in the medical center's emergency room and soon thereafter in its drive-up testing site. Steadfast, resilient, and compassionate, he was ever present, working day, night, and weekends ensuring his nurses were supported and that patients were well cared for. He also stepped up to co-chair the medical center's vaccination programs, personally giving out the first vaccination and then hundreds more. Congratulations, Thomas Amatrano. Since joining Atlantic Health System in 2017 as Vice President of Insurance Networks, Kevin Joyce has gone above and beyond to lead the integrated healthcare delivery system's managed care, insurance, and direct-to-employer strategies. Throughout the pandemic, his talent for innovative solutions stretched him beyond his established responsibilities to Atlantic Health patients. Under his leadership, the system's corporate health team provided clients with Atlantic Health's COVID Safety Check program, helping them orchestrate employee testing and screening programs while providing COVID education and training. He was also tasked with leading Atlantic Health's clinical participation in the Rockaway vaccination megasite, a role Joyce says has been one of his proudest moments in healthcare. Congratulations, Kevin Joyce. A distinguished physician, researcher, and administrator, Dr. Stephen Labuti has made significant contributions in the field of oncology. As Director of Rutgers Cancer Institute of New Jersey and Senior Vice President of Oncology Services for RWJBarnabas Health, he is committed to enhancing the delivery of high-quality, state-of-the-art cancer care and the conduct of groundbreaking cancer research. Through his vision, construction is underway to build a new cancer pavilion featuring outpatient and inpatient services coupled with research laboratories, retail space, and space devoted to patient education and wellness. Additionally, he has published over 300 peer-reviewed articles, is editor-in-chief of the Nature Journal Cancer Gene Therapy, and holds 11 U.S. patents. Congratulations, Dr. Stephen Labuti. Serving as the President and Chief Executive Officer of St. Joseph's Health in Paterson, Kevin Slavin has made a dramatic impact on healthcare across the state, especially this past year as he worked tirelessly addressing a host of critical issues facing hospitals amidst the COVID-19 pandemic. Adding to his responsibilities, he had the opportunity to serve in statewide roles during the pandemic, both as the 2020 chairman of the New Jersey Hospital Association and on the New Jersey Governor's COVID-19 Professional Advisory Council, on behalf of New Jersey's 71 acute care hospitals. He also helped establish a statewide personal protective equipment distribution system, ensuring an equitable process for supplying necessary items to frontline workers. Congratulations, Kevin Slavin. As a registered nurse and AVP of Professional Development at Cooper University Healthcare, Linda Valenti is known as a positive force, always willing to serve where needed. This was particularly evident during the COVID-19 pandemic as she took on the responsibility of setting up multiple community testing sites throughout South Jersey that provided testing to more than 108,000 people to date. Later, when Cooper's COVID-19 response turned to vaccine rollout, Valenti once again was instrumental in rapidly developing multiple vaccination sites. She also served as a resource for many COVID-19 community education materials and the application for a multi-million-dollar grant to provide testing and services to underserved populations severely impacted by the pandemic, which Cooper won. Congratulations, Linda Valenti.
My proudest moment is when I worked with an undergraduate student who had been told for a long time that she couldn't be a doctor. I'd heard those same messages and I had the same resume, great grades, great community service, but I just didn't fit in. Well, I taught her how to fit in and she got into medical school with options. So that was one of my proudest moments.
It was the opportunity to work at the Morris County Mega Site with the County of Morris, the state, the National Guard. You know, for a finance person, given the opportunity to work the front line and be able to make a difference in people's lives. We did over 340,000 vaccinations. It's probably an opportunity that I'll cherish forever.
One of the proudest moments of my career was saving a 29-year-old young mother with a 6-month-old baby at home. And I thought to myself, if she hadn't been able to be treated the way she did with all this technology, she wouldn't be here and her son wouldn't have the mother who's raised him.
The proudest moments in nursing was having an article published in Nursing Home magazine, which was entitled CNA Empowerment. This article was based on the success of the CNAs at Broadway Health.
One of the proudest moments of my career, whether inside or outside healthcare, has been watching the achievements of my children. I've been blessed with 3 wonderful children. All have attended school, both college and graduate school, have wonderful jobs, and have families that include 5 grandchildren.
Outside the healthcare profession, my proudest moment or achievement is really to have a nice family, lovely wife with 4 kids.
Certainly outside the birth of my 3 children, inside the healthcare profession, I think probably this past year, watching the team that I'm so privileged to work with and how they responded to the pandemic and continue to focus on the safe care of our cancer patients.
One of my proudest moments is hands down running the Fat Head Half Marathon in Boston with my girlfriend, now fiance, Priya Shah.
I am so proud of the women who belong to the auxiliary. They give of their time, talent, and money for scholarships that we give out annually.
I would say it would be personally having my 3 children, also obtaining my BSN while pregnant with my twins. I really loved being an IVF coordinator and helping people build their families. And then finally, I really enjoyed building a remote patient monitoring program from the bottom up. That was really, really inspiring and made me very proud.
I'm super proud of my wife and kids for the past year and a half. Between work and remote school, they really showed a level of resiliency that I don't think we saw in our elementary school kids or expected. They really stepped up and had amazing teachers to support them throughout the year and are still succeeding to this day.
I've worked for nearly 3 decades creating innovative solutions to help patients overcome infectious diseases. And my training and background came into sharp focus in the early part of the pandemic as we developed rapid technology to detect SARS-CoV-2, which has now been used to diagnose several 100,000 patients, as well as developing a treatment program with high-titer plasma neutralizing antibodies.
I am incredibly proud of my partners at the Cooper Incident Management Team. So much effort is placed on keeping our patients, family, and staff safe while we are driving testing, vaccines, and providing care across areas that we serve, with a special focus on the disadvantaged populations.
My proudest moment was September 18th, 1999, when I gave birth to my triplets. My husband of 36 years and I are so proud of these 3 young adults. One is going to school at Stevens in Hoboken for computer science. Both of the girls are going to FDU in Florham Park, one for marketing and the other is an aspiring nurse.
Wow. What an amazing group of individuals and organizations, and what a great state we all live in. Congratulations to everyone, but we are not done. Now it's time to recognize the NJBIZ Healthcare Heroes Lifetime Achievement honoree, Dr. Robert L. Johnson. With a successful career in healthcare spanning more than 45 years, Dr. Johnson's impact has been far-reaching. From his involvement in launching a free health clinic for young people in New York City in 1973, known today as The Door, to his service on the Governor's Advisory Council on HIV/AIDS and related blood-borne pathogens since 2003, to his current dual roles as Dean of Rutgers New Jersey Medical School and Interim Dean of the Robert Wood Johnson Medical School. As someone who was always planning, Johnson had actually made a plan to become a doctor at the age of 9, when he made the announcement to his church youth group. From that point on, his focus was on becoming a doctor. Taking all of the appropriate steps, he earned his medical degree from the College of Medicine and Dentistry of New Jersey, now Rutgers New Jersey Medical School, in 1972. He eventually found his niche in adolescents and young adult medicine, focusing on issues ranging from physical and mental health to substance and alcohol abuse to suicide and AIDS, and becoming a well-recognized spokesperson on adolescent topics. At age 75, Johnson continues to maintain an active schedule of teaching, conducting research, and treating adolescent patients at the New Jersey Medical School. He continues to chair the medical board of The Door and serves as a professor of pediatrics and director of the Division of Adolescent and Young Adult Medicine at the New Jersey Medical School. The recipient of numerous awards and honors throughout his long and successful medical and academic career, including the Best Doctors in America Award, the NAACP Leadership and Health Award, the Boy Scouts of America Northern New Jersey Council Good Scout Award, and the New Jersey Governor's Award, it is my honor to now add the NJBIZ Healthcare Heroes Lifetime Achievement Award to Dr. Johnson's long list of accomplishments.
Thank you, NJBIZ, for honoring me today with this Lifetime Achievement Award. It provides a highlight of all the things I've been able to do over the last 50 years. Of course, none of these laudatory outcomes could have resulted from my own work alone, but it is the contribution of many thousands of individuals whose intellect and dedication and vision have resulted in the programs we have been developed that address many of the most difficult outcomes that have faced youth in our community during this last half century. So It is very fitting that as I accept this award, I honor those individuals who worked with me, because without their participation, they would not have been achieved. I also have to give honor to the individuals in my family, especially my wife, Maxine, who supported me and allowed me to engage with these activities with energy and commitment over time. Thank you very much for what you have recognized in my career, and I am indeed honored and humbled.
Congratulations, Dr. Johnson, and thank you for all of your contributions over the years to the health and well-being of all of us that live in the great state of New Jersey. And that concludes our event. Congratulations to everyone honored today and to all of the healthcare workers out there. Thank you for your acts of kindness, your innovations, your immense sacrifices during this pandemic, and your continued efforts to improve healthcare in New Jersey. You are heroes to many. I'd like to once again thank our presenting sponsor, Horizon Blue Cross Blue Shield of New Jersey, our major sponsors, Hackensack Meridian Health and New Jersey Innovation Institute, our live chat sponsor, Capital Health, and our supporting sponsors, Bergen Newbridge Medical Center, RWJ Barnabas Health, and St. Peter's Healthcare System. I would also like to thank those that submitted videos and all that chatted with us during the presentation. Finally, thank you to the entire New Jersey business community for supporting us in these very challenging times. It means the world to all of us at NJBIZ. For over 30 years, we have been the voice of New Jersey business news digitally, in print, in person, and also virtually. We are here because of you, and we continue to be in this together. We are all New Jersey strong. Be safe, stay healthy, and next year, this better be in person.